Recently, in one of the mock OSCE exams where I was an examiner, I've noticed that candidates were struggling with the scenarios that had vague symptoms. Symptoms like this: Doctor, I'm tired all the time. This is the presenting symptom. Or, Doctor, I feel anxious. Doctor, I'm confused. Doctor, I feel funny in my chest. I'm not alright, doctor. Unfortunately, the doctors were struggling. The only reason they were struggling is they did not know what um, system to take history or what system to examine. And believe me, 95% of candidates failed this scenario. And anytime I do role plays during my workshops or during my webinars, I usually concentrate on this topic because I know that candidates struggle. See, tiredness, what is tiredness? It can be from any etiology. So I have a strategy on how to approach such symptoms. Vague symptoms are very difficult. I used to struggle when I was preparing for my clinical exam as well. So how I approach such scenarios is I ask the patient, what do you mean by feeling tired? That is my first question I ask my patient. Or I ask my patient, what do you mean by feeling anxious? Or what do you mean by feeling confused? What do you mean by feeling funny in the chest? What do you mean by I am not alright, doctor? See, once you ask this open-ended question, the patient will give the complete history. Once you ask open-ended questions, they will give you full history, and based on that, you need to proceed. You need to go to which system is affected. It could be tiredness scenario can be something simple like depression, and this is the scenario we had in the OSCE exam, which is postnatal depression. Young female, 3 months post pregnancy has come to you. You are a general practitioner complaining of tiredness. For some reason, doctors were struggling with this scenario. So there is a strategy there. As I said, ask the patient, what is tiredness? Or what do you mean by feeling funny in the chest? And the patient will explain. Then from there, plan your scenario. Then go on to closed-ended questions. I hope this strategy helps. And if you like this video, you will like the full video training I'm going to send to your email. Recently, in few mock exams, I've noticed that candidates were doing 26 common mistakes. So I've done a video training course on all those 26 mistakes, and I will be sending those videos to your email. So make sure you click the link either above the video or below the video and watch the first biggest mistake, and I will be sending all the other videos to your email.